In today's class, we will study the antitubercular drugs. Tuberculosis is one of the disease caused by Mycobacterium tuberculosis. This is one of the bacteria. The drugs which kills the Mycobacterium tuberculosis, or else the which stop the growth of the tuberculosis. Those drugs are called antitubercular drugs. Now we'll study one by one. So first of all, the word meaning, how the this antitubercular drugs meaning is there. Word meaning. The first, if you split, then it become anti plus tubercular. The anti means against, tubercular means the tuberculosis. Antitubercular drugs are the drugs used to treat the tuberculosis. The drugs which treat the tuberculosis disease, those drugs are called as antitubercular drugs. So now the definition is antitubercular drugs are the antimicrobial agents. These are antimicrobial or antibacterial agents used for the prevention and treatment of the tuberculosis caused by Mycobacterium tuberculosis. This is called as a antitubercular drugs. Now the ideal properties of antitubercular drugs, which tubercular drug is considered as an ideal or best one. The effective against the Mycobacterium tuberculosis. Next one, good penetration capacity into the tissue as well as the macrophageal. Next, minimum toxicity, prevents the drug resistance and suitable for long-term therapy more than 6 months we are using. If it is all these qualities are there in any drug, that is considered as an ideal property of for the tuberculosis antitubercular drugs. Now we study the classification. If you classify the antitubercular, mainly it is classified into two types. One is the first line of the drug, second one is the first line drug and second line drug. First line of the drugs, those are commonly we are prescribing for the patient. Second line of the drugs, here, if the first line of the drug is not effective due to the resistance, or else the patients any adverse effect is produces, then only we are advising for the prescribing second line of the drugs. Now, like that, we are classifying into two classification. Now we'll study one by one. The first of all, the first line of the drugs. The first line of drugs in the mnemonics is commonly HRZES. These 5 drugs are called as a first line of the drugs. For H for Isoniazid, R for Rifampicin, Z for Pyrazinamide, and E for Ethambutol, and S for Streptomycin. These are the 5 first line of the drugs commonly we are using to treat the antitubercular drugs. The first of all, Isoniazid. H, that is Isoniazid. Second one, Rifampicin. Third one is Pyrazinamide, Ethambutol. These are 4 drugs we are commonly prescribing whenever you find the tuberculosis is positive in the chest X-ray, or anywhere the CB naught is positive, then common these 4 drugs of we are prescribing. First, the line of treatment is total 6 months. The common average treatment is 6 months. In that, the first 2 months we are prescribing these 4 drugs. Commonly the brand name is AKT4. This brand is coming that contains the first 4 drugs. If it is not effective, then we are adding another drugs, Streptomycin injection. Also, this is the 5th drugs. The commonly we are prescribing these 4 drugs. After the first 2 months, prescribing these one. After the 2 months, from the 3rd month, the again 4 month we are prescribing only 2 drugs. That is AKT2. Like that, the treatment we are giving for the as a antitubercular drugs. Now the second line of the drugs, if the first line of the drugs, that is any adverse effect produces or resistance, then we are prescribing the second line of the drugs. Those are Levoflox, Moxiflox, Ethionamides, Cycloserines, PAS, Bedaquilines, and Ethionamides. These are the drugs. This is the second line of the drugs. Now we'll study the mechanism of action, how these drugs are effective. You know, this is the Mycobacterium, one of the bacteria it is there. The drugs which kills the bacteria, or which prevents the or which multiplication will stop the bacteria, those drugs are called antitubercular drugs. Now one by one we'll study the how the drugs, these antitubercular drugs, their mechanism of action individually will study. The first of all, the Isoniazid. Isoniazid, the bacteria, the Mycobacterium, its outer layer or boundary is very strong. That is these drugs, Isoniazid, inhibit the mycolic acid synthesis. The outer ring, the main strong Mycobacterium ring is present, outer layer, that is the mycolic acid. These drugs, Isoniazid, which breaks or inhibit the growth of this layer, that is mycolic synthesis. Due to that, the bacteria easily killed. This is the first Isoniazid. Next one is the Rifampicin. Rifampicin, these drugs will stop the multiplication, because the RNA is the main cause for the multiplication. Here, the inhibit the RNA synthesis. Rifampicin, whenever you prescribe the rifampicin, it will enter bacteria, and rifampicin multiplication will inhibit. Due to that, the multiplication stops. Due to that, it is easily treated. Next one is the pyrazinamides. Pyrazinamides, the bacteria is present in the intercellular space. There it is, these pyrazinamides acts on the intercellular bacilli. There it will enter and kill the bacteria. This is the pyrazinamide mechanism of action. The next one is the ethambutol. Ethambutol inhibit the cell wall synthesis. This cell wall synthesis inhibit. Due to that, the bacterial lysis in that. Due to that, the bacteria will kill. The next one is the streptomycin injection. The streptomycin, this is the ribosome. It kills the protein synthesis. That is the stop. What happened here? They inhibit the protein synthesis. That is the food supply. This streptomycin injection, if you give the patients, then inhibit the protein synthesis or else ribosomes. Due to that, its food supply chain stops. Due to that, the Mycobacterium will lose their life. That is the main reason how these mechanism of action of these lines of the drugs, the commonly Isoniazid, Rifampicin, Pyrazinamide, Ethambutol, and Streptomycin, these drugs, their mechanism of action. Now the therapeutical uses, where in which diseases we are using these Mycobacterium antitubercular drugs. The first of all, the pulmonary tuberculosis. Pulmonary tuberculosis means the tuberculosis inside the lungs. That is called pulmonary tuberculosis. The common one, the more than 70% cases are came to your hospital. This is the case. The first of all, this class of the drugs will effective against the Mycobacterium, this pulmonary tuberculosis. Extra pulmonary means other than lungs, it may be joints, so it may be lymph nodes. There also this drug is effective. Next one is the latent tuberculosis infection. It means that in the family member, if one is positive, another is negative, but the chances are there is a inactive tuberculosis also present. Latent tuberculosis infection means tuberculosis is present but is not in an active form. There also we are prescribing the anti-tuberculosis drugs, that is therapeutical action. Next one is the multi-drug resistance tuberculosis. In some cases, the patient is not continue treatment due to the incomplete course or due to that some causes, the drugs become resistant. In that cases also we are prescribing anti-tubercular drugs, especially second line of the drugs. This is the therapeutical uses is multi-drug resistance tuberculosis also we are using. Now we will study individually one by one adverse effect. What are the adverse effect due to this class of the drugs? Now first of all, Isoniazid. Isoniazid, this is the very common adverse effect. You can see the tingling sensation, that is tingling sensation in the limbs, upper limbs, lower limbs. The commonly patient complains the numbness and tingling sensation. Peripheral neuropathy is the main adverse effect. The next one, rifampicin, the urine become the orange and red. Whenever you are prescribing the rifampicin, you have to advise that these are the adverse effects. The commonly this color urine will patient will pass, that you have to advise. Next one is the pyrazinamide, that is the hyperuremia, that is the uric acid increases due to the joints pains are the common adverse effect due to the pyrazinamide. Next one, ethambutol, the optic nerves, the eyes become weak. This is the one of the adverse effect due to the ethambutol. Next one is the streptomycin. Due to the streptomycin, the ear also become weak. That is ototoxicity because of the streptomycin. Next is now we will study the next dot center, Akshay or Nikshay center. This is the dot center. Dots is one of the government WHO organization advised to every government hospital dot center. This is dots means direct observed treatment short course. D for direct, O for observed treatment, T for treatment, and short course. It means that every government hospital dot center is there. Their duty is that if the patient is suffering from the tuberculosis, some workers or some asha karyakarta in front of there only you have to give to the patients. It means that patient, why? Because to avoid the resistance or incomplete course, this center is open in all the government hospital. Now the name is changed, Akshay, Nikshay also. This is the DOTS, direct observed treatment short course. What are the benefits here for this dot center in the government setup? Because ensure the compliances. It means that to complete the course, if there are any adverse effect, we have to know what are the causes. Due to that, the dot center is started in the government. Next one is the prevent the resistance, because incomplete course, due to that the drugs become resistant. Avoid that is the case. Next is the improve cure rate. If you are 100% you are observing that patient is taking the medications, then the chances are more for the treating 100% result. Lastly, MDR. MDR means multi-drug resistance. It means the antitubercular drugs are not effective against the tuberculosis. This is the common case that so many drugs are ineffective. That is called multi-drug resistance tuberculosis. It is a very tough treatment because the first line of the drug is not effective. In that cases, we have to select the second line of the drugs, and treatment is very tough. Instead of 6 months, we have to prescribe 9 months, 1 year or 2 years also. This will course will goes, and it will take long time to treat the patient. That's why the dot center is started. Now the resistance, very common resistance of the drugs is isoniazid and rifampicin. These first isoniazid and rifampicin, these are common resistance are there in the patients of these drugs. This is all about the anti-tuberculosis drugs. Hope you understood the today's class. If you understood, please share your classmates, friends, and also please like, share, and subscribe. Thank you.